Thanks for staying with us here on The Pulse. Other stories now. Ghanaian healthcare professionals, particularly nurses, are set to benefit from new employment opportunities in Grenada following the signing of a memorandum of understanding between two countries. The agreement was finalized this Friday during the official visit of Grenada's Prime Minister, Dickson Michel, who was received by the President, John Dramani Mahama, at the Jubilee House for bilateral discussions and state lunch as well. Well, President Mahama said both countries are committed to exploring collaborative arrangements that align with their national needs and healthcare priorities.
Between Ghana and Grenada exemplifies an excellent model of South-South cooperation. During my productive discussions with Prime Minister Michel earlier today, we mutually agreed on the importance of expanding our collaboration in key areas, particularly those that utilize our comparative advantages for mutual growth. In the health sector, Grenada's interest in recruiting Ghanaian nurses and allied health professionals presents a valuable opportunity for structured collaboration between our two countries. Ghanaian health workers have gained international recognition for their professionalism and their compassion. And we're keen to explore arrangements that address both our national needs and Grenada's health priorities. In education, we can develop partnerships through teacher exchanges, student mobility, and research collaboration. In agriculture, there's potential for collaboration in climate-resilient farming, food security, and agribusiness. In renewable energy, we can work together to promote cleaner and more affordable energy sources that align with our sustainable development goals. And in heritage and diaspora tourism, Ghana and Grenada can jointly promote cultural connections that honor our shared roots and provide economic opportunities for our people.
President Mahama expressed concern about the lack of a direct flight linking Ghana and the Caribbean, urging stronger collaboration to address the situation and improve connectivity between the two regions.
However, one significant barrier continues to hinder our cooperation, and that is the lack of direct air connectivity between the Caribbean and Africa. Despite being only 6 hours apart by air travel between our regions can take nearly a full day, often routed through Europe or North America. This limitation restricts the movement of people, goods, and services between the Caribbean and Africa. We must collaborate to change this situation. Ladies and gentlemen, allow me to touch briefly on an issue that holds deep meaning for both our nations: reparations for Africa and the people of African descent. As the African Union champion for reparations, I see this cause not as a plea for charity, but as a demand for justice and restoration. The African Union's 2025 theme, Justice for Africans and People of African Descent Through Reparations, rightly reflects the core of our collective struggle. Grenada has long been a brave voice in this movement, and I look forward to Ghana and Grenada collaborating alongside other partners in CARICOM and the African Union to promote this moral and historic cause. At the UN General Assembly this year, I served notice that Ghana intends to file a motion at the United Nations next year to declare slavery as one of the greatest crimes against humanity. And Mr. Prime Minister, I know I can count on your support and the support of our colleagues in the Caribbean and the African Union to support this motion.
Well, Prime Minister Dickson Michel pledged Grenada's full support for Ghana's proposed resolution at the United Nations, stating that his country will gladly associate with, adopt and back the motion. Ghana plans to introduce a resolution at the United Nations General Assembly to officially declare the transatlantic slave trade as the greatest crime against humanity and to demand reparations for its lasting impact. Well, President John Dramani Mahama announced this intention during the 80th UN General Assembly session on September 25th, 2025.
Is why we in the Caribbean are deeply committed to the issue of reparation. It is not just about economic justice. It is not just about reversing the significant negative legacy of colonization and neo-colonization, and in some cases the imperialism that still continues. But it is first and foremost about our human dignity. So, Your Excellency, I can assure you that Grenada and all of CARICOM stand ready to support this resolution. We stand ready to continue the conversation and the fight for the acknowledgement that slavery, the transatlantic slave trade, is in fact perhaps the worst human crime that has been committed against humanity, and that we should recommit to ensure that it never happens again. And we can't do so if people are not prepared to accept that it is wrong. We can't do so if people are not prepared to accept that it is legally not acceptable, and that there should be universal commitment to ensuring that it never happens again. And so we gladly associate, adopt, and will, with Ghana, the proposed resolution, and we look forward to it passing unanimously and successfully at the United Nations.
Let's shift our attention to the health front. Now, the Ghana Association of Certified Registered Anesthetists has threatened to embark on an industrial action over government's delay in recognizing them and the separate regulatory body. Now, following years of agitation, the group says they've had enough. Speaking at the annual general meeting in Sunyani, the association's president, James Wasangra, described the anesthetists placed under the Medical and Dental Council as completely misplaced. He called on the government to act immediately to avert any unfavorable action. Precious Semevo reports.
The 7th Annual General Meeting and Scientific Session of the Ghana Association of Certified Registered Anesthetists, GACRA, among others, recognized a member, Harriet Otin, of the Adan Government Hospital for her dedication, swift and selfless intervention that saved the life of a pregnant mother at the Adan market in the Eastern region. Speaking on the theme, Advancing Skills and Critical Thinking in Modern Anesthesia, the president of GACRA, James Wasangra, emphasized that the right support of equipment and skills will ensure effective anesthesia services. He enumerated challenges including poor working conditions, non-existent scheme of service, a lack of structured career progression, and a manpower shortage that requires urgent attention.
Currently, 30% of those trained CRAs have left the shores of the country for greener pastures. However, in a recent survey, the number of CRAs stood as 943. That falls short of the 1,200 that was existing in 2023. Clearly, the figure has a direct pressure on the few service providers in Ghana. It means that one anesthetist here is to 34,944 Ghanaians. The number of CRAs trained per year by the training schools, we can look at it as woefully inadequate. We are therefore calling for an expansion and addition in the number of anesthesia training schools in Ghana. He
called on the government to recognize them under a separate regulatory body instead of the Medical and Dental Council to avert industrial action.
Regulation of CRAs under the Medical and Dental Council, that I deem is a complete misplacement. Medical and Dental Council, with all due respect, that it is meant for dental and medical practitioners. GACRA has fought for a separate regulatory body, either than the Medical and Dental Council over the past years. This call has not received the needed attention. Today, we as CRAs are calling the government in its reset agenda to act now. Otherwise, we shall be forced to act unfavorably, and the only language that the government understands for CRAs We know when to do it and how to do it, and we do it better than other unions.
In a speech read on his behalf, the Health Minister, Kwabena Mintah Akando, acknowledged GACRA's concerns with an assurance of measures to address them, including the need for a proper job re-evaluation towards a better salary scale. Precious Semevo, JoyNews, Sunyai.
All away from that, the Deputy Chief Executive Officer of the National Health Insurance Authority, Kwame Jokoto, has hinted at the introduction of new tariffs by 2026 following client concerns. He indicated that the authorities are engaging all stakeholders, including the World Bank, to ensure tariffs match the cost of operations, smooth administration of health facilities, and ultimately enhance healthcare delivery. He made this known when addressing the 5th Annual General Conference of the Private Health Facilities Association of Ghana in Ho.
The 5th Annual General Conference of the Private Health Facilities Association of Ghana gave stakeholders a platform to discuss issues affecting healthcare delivery and iron possible solutions. The national president of the association, Dr. Kwame Boaben Frimpong, stressed the need for enhanced collaboration between private facilities and the government towards achieving universal health coverage.
That we are all contributing to the health of our own people, whether private or public. So in the same way that government found the need to support the Christian Health Association of Ghana with human resource, we are asking government to consider hosting human resource or the professional calibers to private health facilities as well.
The Deputy Chief Executive Officer of the National Health Insurance Authority, Dr. Kwesi Jokoto, responded to a call to increase tariffs for service providers of the scheme.
Our CU and the Ministry of Health are working closely to engage all stakeholders so that by the end of the year, the new tariffs would be rolled out. This has been one major concern when we engage all facilities, and I'm not surprised that it has also come in as one of the concerns of the private health facilities. We believe that when these new tariffs come in, it will help to facilitate a lot quality healthcare delivery.
The Chief Executive Officer of Kasona Global Imaging Limited, John Tigbu, said his outfit aims to tackle the challenge of inadequate advanced machinery and human resources in the health sector.
The modern equipments now come with modern devices like AI. Most of the doctors you see and radiologists have never even seen those equipment. They went to school with the equipment that is 10 to 20 years old. So how can they operate the modern equipment? So training is another thing that we did. Notice that we needed to take care of. What I came to do is to provide affordable equipment, make sure we have local engineers to fix it, train the medical professionals on how to use it, and provide them credit facilities to buy it.
Fred Kwame Asari, JoyNews, Ho.